I'll start by performing hand hygiene and check my patient's identity with 2 patient identifiers. Afterward, I would make sure all my equipment is assembled in one place, and I would also provide for privacy. I'd make sure my tubing is clamped. For the sake of the video, I'm leaving the lube cap on so he won't get any lubrication on his clothes. After I make sure my tube is clamped, I will check, fill the bag with between 750 and 1,000 milliliters of lukewarm water. After I completed that, I will put my soap in there and mix it well. I'm going to test the temperature on my inner wrist by unclamping it, of course, and then also allow all the air out of the tube by also unclamping it until I get water, and I'm going to reclamp it. I'm going to make sure the top of the bag is closed securely and put it somewhere where it won't get away. I'm going to assist my patient to the left side Sims position with his right knee flex. His left knee flex. Right knee, I'm sorry. Okay. And then I'm going to put a bath towel over him. Bath blanket, I apologize. And then I'm also going to put my gloves on afterwards. And I'm going to put a waterproof bed pad under him. I'm going to lubricate the end of the tube 2 to 3 inches and lubricate 2 to 3 inches. And I'm going to visually inspect his anus by spreading his buttocks apart. And after I complete that, I'm going to check for external hemorrhoids. After I've completed those steps, I'm going to ask my patient to take some slow, deep breaths while I'm gently inserting the tubing 3 to 4 inches, because he's an adult, towards the umbilicus. And after I have it inserted and anchored, I'm going to unclamp it with the bag 18 inches above my patient. While I'm doing this, I'm going to listen to my patient to make sure he doesn't have any complaints of stomach cramps. If he does, I'm asking him to take slow deep breaths while I am lowering the bag to slow the infusion. After about 5 to 10 minutes, and after I get the right amount of solution infused, I'm going to reclamp it while gently removing the tubing and having my patient to squeeze his buttocks together for several minutes, and I'm going to try to have him hold it for as long as possible. When I check the, afterwards I'm going to check the character of the feces in the solution, and then after that I'm going to document the amount of solution I used and how well he tolerated the procedure.